Well, hello. This presentation or lecture, if you consider it, focuses on analysis of problem-based case studies for the purpose of diagnosing speech and language disorders. So this is part of the grad program Diagnostics class. So first, we're going to discuss considerations for an evaluation. How do you go about an evaluation? What do you keep in mind? And then we'll speak about case history, and then we will speak about cases and particular case studies and how you look for cues in these case studies and how you analyze them to be able to determine how to proceed with your assessment. So first, when planning an evaluation, you need to organize your thought. The whole process should be organized, not around the test that you are going to administer. That is not the idea. It is not like you have a hammer and then you are looking for nails or something simply because you have a hammer. You need to look at the areas of concern. Someone refers himself or herself to you, or someone is referred by a team member. They refer because they have a specific concern. When you understand that concern, that is going to enable you to focus on the area itself and find out why it is an area of concern. You go and find a tool, a testing tool that you can use to determine if that area, for example, is indeed an area of disability for this particular person. So you begin with trying to find out, making a list of the concerns that the patient or the client or the teachers, parents, anyone who is involved as a team member, list all the concerns that they have. And you get this information from your case history, from your interviews, and all of this. So again, the focus is not what testing tool you are going to administer initially. The focus is identifying the areas of concern and then finding the specific tests that are the best tools to dig deeply into these concerns and to identify if indeed there is a disability in this area, to identify it. Then the second step, when you kind of develop that list of concerns, based again on everything that you do, is to cluster these areas into bigger categories and to determine what kind of instrument will could best be used to diagnose a disability in these particular areas, or to evaluate the performance of the client in these particular areas. So I'll give you an example here. You have a list of concerns and a group of professionals and the parents, case history, whatever. You identify, for example, these following areas as areas of concern. And they would like to know, number one, for example, is there a true disability in this area? If there is, how is it affecting other things? How is it accounting for the academic difficulties the person has in the classroom? So you are connecting daily living skills with your scientific background about communication disorders and also the tools that you evaluate. So this is why you spend, 2 full years studying the sciences of communication disorders before you get into the grad program. That information you should have accessible to you today as you are in grad school. So these areas, for example, include difficulty following multi-step directions. When you describe following multi-step directions, we call that executing multi-step directions. To actually put someone's directions into action. the camera might be a little bit fuzzy for a few minutes. The sun is shining through the office, so it might cause. But anyways, it is at least you can hear it at least. So then the second area is difficulty with comprehension. These are frequent areas, by the way, that you will encounter, and difficulty recalling sentences. So these are potential areas, say, pretending that someone comes to you with these concerns. When you look at difficulty with following multi-step directions, you want to find out, go back to what you have learned about, communication disorders and cognitive disorders and so on. These, number one, multi-step directions, difficulty in them can be caused by a number of issues. Number one, can be caused by poor memory, working memory skills, can be caused by attention problems, can be caused by difficulty with vocabulary. Someone doesn't have enough vocabulary. If a word is new to you, you are not going to recall it. It will not stay much in your mind as you try to recall it. The longer you have the word in your vocabulary, the faster and more easily accessible it will be. So vocabulary is a potential problem. It could be, but we don't know. This is just, you have someone who has difficulty with multi-step directions. And you kind of ask yourself, is it because of vocabulary? Is it because of working memory? Is it because of attention? So you are going to need to administer some testing of vocabulary and also working memory and attention, either a sub-test or a test. Ideally, if a team member has already, like the psychologist, has already administered testing in that area, or if you have a neuropsych eval, you are going to find all of this information on file, but the report has to be, should be recent. So in that regard, or if someone has a whole history and they say have ADHD, and you have consistently report after report, they document there are attention problems, there are memory problems, then you could go and administer the vocabulary testing, include it in your testing evaluation, because you are going to add a piece to that. And then you are going to determine how much of it contributes to vocabulary, or if the person might have above average vocabulary. In that case, you are going to exclude the vocabulary. So again, at that stage, when you look at this area of difficulty, multi-step directions in the classroom or at home and so on, you are going to say, oh, these can be possibly caused by vocabulary deficits, working memory problems, or attention problems. And then these areas, somehow you have to get scores in these areas, whether you are going to administer testing in this area yourself, especially vocabulary, you are the expert in that. And if you find scores with other people who see the child, either a neuropsych or a psych eval that has memory and attention scores, you do not have to administer that yourself. So that one area is settled now for the time being. Now you look at the other area, difficulty comprehending orally presented information. And then you think to yourself, what are all the possibilities that can cause a comprehension problem? Number one, again, vocabulary. Number two, attention, working memory, and add to this auditory processing. So you have 4 potential areas. How do you, once you have identified these, you are going to say, what kind of testing am I going to use? Again, you are going to use the same vocabulary testing that you will use to determine if vocabulary contributes to attention, to memory problems, following directions. And also, you are going to need to also evaluate working memory skills, the same testing that you will use to follow multi-step directions. And then, attention as well. So simply, if you get a test, working memory, you look for testing immediate number recall forward, and immediate number recall backwards, reversed. And you also test the ability to recall sentences and the ability to recall words immediate word recall and immediate sentence recall. And you should also find some kind of test that looks at paragraph recall, if you can. Usually psychological tests would have that. But if you do not, then you can just rely on the other language testing that you have. But for these three components, digit recall, forward, and word recall. Digit recall tells you how the person is doing in rote memory. Numbers do not have necessarily don't have linguistic meaning, but they tell you an idea about memory, working memory, short-term memory, which is part of working memory. And then when you add meaning to that, and you have someone recalling words, these words are going to have meaning. They should facilitate the recall. Does the person do well with numbers forward as compared to word recall? And if so, that means when you add meaning, the person can process the meaning and do better. Now, will the person's performance improve with sentences compared to single word recall? Like when you say 5 words and you have the person recall them, compared to making a whole sentence. What do you expect? Typically, someone is going to do better on sentence recall than in single word recall. The reason is that sentences are like little stories, and we are tuned to little stories. The little story of the sentence gives you a whole context, and the context is rich with linguistic cues, and these linguistic cues will activate your memory. They will facilitate recall. So the natural way of development for working memory skills in terms of short-term memory, you are going to have word recall, for example, at a certain level, but you should have sentence recall better. But if someone has attention problems, you are going to find that the trend is worse, because attention and specific memory, attention problems and distractibility, then the person might just get distracted quickly in the middle of the sentence, and the performance goes down. So the way that you interpret these scores is going to depend on your level of understanding of what each test or subtest evaluates, and then you make the connections. So now, when someone does well recalling words and recalling sentences, how do they do in recalling paragraphs? If they have attention problems, their performance will decrease as the length of the information increases, length and complexity. If they have memory problems, specific memory problems, then they also, and they say, for example, words are decreased, sentence recall is decreased, that absolutely will have an impact on the ability to recall paragraphs, because the paragraph is lengthy, is more detailed, it requires more focus, more attention. So this whole skill, all these skills, words, sentences, and paragraphs, all of these go from the easiest and rise to the hardest. And if someone's performance decreases as you go up, then that will tell you the person likely has attention problems and so on. But now when you look at vocabulary, if someone doesn't know a certain word, or they just have recently learned it, they will have difficulty with recalling words. They will have difficulty with recalling sentences, and they will have even more difficulties recalling paragraphs, information in paragraphs, and answering questions about stories that you read to them. So in these cases, you are going to think now, is the problem memory? Is it attention? Is it vocabulary? Is it language processing itself? So does it have anything to do with auditory processing? And you cannot possibly go and give every test that's available out there. You have a particular time that you need to administer the testing, and deadlines and all of this, and you have many cases to deal with. So you use information from your case history to exclude areas that you shouldn't be testing. and to include focus on areas that you absolutely have to test to answer the questions that were asked about these concerns. So in this case, you ask the questions about comprehension. Of course, you are going to administer the same vocabulary test from the same results. You are going to use it to interpret comprehension problems, multi-step directions, and also recalling sentences, because vocabulary is a factor that can cause any of these. We are not now saying that in this case it does, and this is why you evaluate. You want to confirm. So vocabulary testing here is a must. And typically in any language evaluation, vocabulary is almost a standard. So then, what else can cause comprehension? You are going to look at the same thing, working memory and decreased attention. All of the same areas for multi-step directions are also related to comprehension and also related to recalling sentences. All of them are related. So vocabulary consistently will tell you if it is a factor in any of these. And then the ability to recall words, sentences, and numbers, and paragraphs, that is also a factor in all of these. And then the ability to focus on decreased attention, how do you test it? Simply, you should look for any evaluations that you find on file. SLPs typically do not diagnose people with ADHD, but you can have a general idea about their performance, their ability for mental concentration. To simplify, when we say working memory, you know it. Working memory has two major components. Number one, it has short-term memory, recall of information, of digits, words, and so on. And number two, it has cognitive manipulation and cognitive concentration. So these two areas, a component of attention and short-term memory together, enable you to have working memory. Working memory enables you to retain information in your mind for a short period of time, seconds or a couple of minutes, and to be able to do more than one thing at once. So, like multi-step tasking, 2 tasks or so. So now, you can simply, when you give a number of digits and say to the person, recall them backwards to me, that tests the ability, cognitive concentration, and which is a component of attention, and the ability to manipulate information in your mind. So you can imagine information 1, 2, 3. When you reverse it, you are taking 3, putting it first, and then 2, putting it in the middle, and 1 at the end. So this is what we use to actually process information, to take it apart, to put it in different places, to make sense of it. This is the engine for information processing. So by administering that simple test and subtest and knowing how to interpret it, you are going to be able to conclude that this person, if that person has difficulty with mental concentration and difficulty with attention, that affect working memory. So then you take all of these areas and cluster them and decide, now I have a list of the areas that need to be tested. What testing should I use? You look for the best test that's available, that is known to actually, have a good validity and reliability. So you, in that area, are going to focus on vocabulary, especially receptive vocabulary. You are going to focus, you need to find some kind of measure for attention, verbally presented stories or paragraphs like the castle or the self. And also you look for some working memory scores in previous evaluations, or some working memory tools that you could administer yourself. And also you need to focus on syntax. Syntax is related to sentence recall. Why? Imagine that you have someone who comes from Germany, or say China, and this person has been here for 2 years learning English, had never studied English before. And the person has been trying to speak the language, has been, for example, in a school and so on. That 2 years is not enough to internalize all the syntactic rules of the language and to fluently use them. So as a result, the person doesn't have spontaneous recall of grammar in his or her mind. As a result, when you give them a sentence, they are not going to be able to recall it because the way that phrases are divided or connected within a sentence to make one whole sentence, the structuring of this grammar itself facilitates the recall, facilitates memory recall. So if someone doesn't have or hasn't yet internalized the grammatical rules of the language, that person will look like as if they have a very decreased immediate sentence recall. So that is an important thing to keep in mind. And the only way to confirm if that person really has a decreased sentence recall is to test them in their native language and to have someone who speaks their native language ask them these tasks to make sure that the person does not have the immediate recall difficulties in that native language. So in any case, this is why, and also people who have language learning disabilities, if someone hasn't yet internalized all the syntactic rules and is performing at age level, that is going to make them have difficulty recalling sentences. So again, the two are related, and in that case you have to administer some kind of syntactic and subtest to evaluate syntax. So in your language battery, you ultimately have to administer these as the main focus. You might have to administer another subtest somewhere here or there to get an overall language score, but these areas must be evaluated by particular tests that you choose. So it is important while you are planning your evaluation, what to use and all of this, in order to build that list of areas of difficulty, it is important to review any evaluation reports that are available on file. Typically, like in a school system or a hospital, the whole team sometimes, they have a deadline and the team begins evaluating. And in many cases, you might do your evaluation after someone else. So you first look for any evaluation that's available at that time. Like say, ask the psychologist, or ask in the hospital your fellow colleagues to, whoever is evaluating as part of the team, if they have scores. They don't even have to have the report. You just get some preliminary ideas about the scores they have, and you could use that to interpret the scores that you get in that regard. And that will minimize the amount of time that you use in order to administer the test, the evaluation. So again, if you find that a team member, like psychologists, for example, they administer a lot of testing, some of the testing that we do, or a neuropsychologist, you might receive a neuropsychological report that has the PBBT already given, and another language assessment is already given. You should not be re-evaluating. You should not be using these same tools. So you could use the same scores and then do the areas that were not covered, for example. So the information is really, really important in terms of working with team members and getting information from them as well. So let me go over a couple of basic concepts here before we begin, as we continue our discussion. When we say criterion, a criterion is a specific condition that if someone meets, that person is going to be admitted as part of a certain group or not. Let's say And the communication disorders, say undergrad program, for example, for someone to take a particular course, that person has to have there are two criteria, for example. I'm just making them up. We could say you must have 2.8 GPA, you must have 15 undergrad credits in communication disorders in order to be eligible to get into this class. So we use what are known as diagnostic criteria. Criteria is the plural of criterion. So we use diagnostic criteria to include someone in a disorder or to exclude someone out. But typically, we don't use the exclusion, we use the inclusion criteria. So to say, for someone to have a language impairment to language disorder, they have to have this condition, particularly very precise, very specific. And if you meet it, and if you meet the next condition, then you have the disorder. If there are 5 criteria and you say you only meet one, and the evaluation criteria will tell you, for example, on top, you need to have 3 out of 5, but you only have 1, you can't make the diagnosis. So these criteria are very precise statements. Not everyone can be included, under them. So when we say the criteria for stuttering, you are going to look for the specific, percentage in this, percentage in that, how, exactly as they are phrased in the manuals that we use to diagnose patients. Another term that you are going to encounter in evaluations and in treatment is the consistency. When you say someone's performance is inconsistent, for example, someone doesn't do well on sentence recall, they do well on word recall, and then they do well in digit recall, and so that performance is inconsistent. They should be doing well all across, but they're not. So inconsistency in language and inconsistency in attention and memory and all of this, these are typically showing that there are some disruptions and there is some kind of disability there. However, in speech sound disorders, when you say someone is saying this sound inconsistently, like the they make it sometimes they do not, sometimes in the initial word position, like ring, they say it. In the final word position, like car, they cannot say it, or they do not say it. In the middle, they may not. Inconsistency when it comes to sound production, that is a good thing. It means if the person can say the sound in a particular context, then they will eventually say it in the rest of the contexts. But it means also that the sound is emerging. So you understand the same word differently based on what kind of area of language or speech that you are dealing with. So if for example, if a person has extremely limited vocabulary and that person exhibits inconsistent performance in comprehension, sometimes, for example, they comprehend, sometimes they do not. So when we look at vocabulary as a primary area of deficit, for example, why will their performance be inconsistent? Why are they understanding sometimes, understand paragraphs and sometimes they do not? When you look into it, the big question you ask is, does the length of the information make a difference? Like, as I continue, say, my paragraph now is three sentences. The person is doing okay. But if I increase it to 5 sentences, will the person do well? If yes, then length of the information is not a problem. How about complexity? How about vocabulary? When I have paragraphs, let's say the person is in 5th grade and I give them paragraphs from 3rd grade. That means the vocabulary is below their age level. So they maybe they will do well here. And what about if I have a short vocabulary, a short paragraph, but it has more words that the child doesn't know? So it does vocabulary complexity, if the vocabulary is much below the person's age or ability or above and so on, that is an area that you have to take in consideration. But inconsistencies in paragraph comprehension, if they are caused by vocabulary problems, they are diagnostically important. They do not go away. You have to find out why exactly this inconsistency is happening. Is it because of the length, or is it because of the complexity of the vocabulary, which the child doesn't have in the first place? How about syntax? Someone is inconsistent in syntax. Sometimes inconsistent means sometimes they use, they are able to do a certain task, and sometimes they are not able to do a certain task. So we are going to look at syntax. If the person has internalized syntactic rules, then we say, no, the syntax is not a problem. Then memory or attention will be a problem. How about morphology? Morphology, if someone, again, performs okay now, and on similar problems, they show that they are not performing well. So inconsistent use, sometimes you use it, sometimes you do not. Like this. Sometimes the child says, my tummy hurted. And sometimes the child says, my tummy hurt. So they use it correctly sometimes and sometimes not. That also means that they are in the process of applying these skills. Establishing rapport. Number one, why we have to focus on this? We need to make the person as comfortable as possible, to make them relate to us really well, because we want to get an estimate of their language abilities, the language skills and speech skills. And we want to take that estimate based on their daily functioning, their natural, unrestricted performance. If someone is shy, especially when you meet someone for the first time, there's that kind of barrier, and people are restrained and they are inhibited and so on. So all of these have to be taken in consideration. When you get someone coming, an adult or a child, you kind of do things to warm up, to make the person, relate to you, to make them comfortable to express themselves, because you'll be asking them many questions and asking them to do things, and you want their performance to be spontaneous so that your assessment of their skills becomes accurate and it shows an accurate picture of how they do on an average day. It is important, whoever is available to help you in the evaluation, like say a parent might be in the room or someone, they should not contribute, they should not say anything unless you ask them a particular thing. For example, could you hold this for me or do that for me? But you'll find some people try to make the person do better by trying to give cues. Oh, you don't remember that. That is going to affect the validity of the testing that you do. Yeah, it might give you an improved performance, but that is not good for the child or the adult, because it will make them look better than they really are. So your goal is simply to find out why, how you can help them. Not just, so you want to get an accurate picture on what they can do independently on their own. In terms of children, you should give them a few minutes to adjust to the new place, to the new people, to, things, and talk with the parent or the caregiver for a few minutes and have them kind of, see how the parent communicates with you. And by looking and observing the comfort level of their parents, they are going to warm up to you, and in a few minutes they will be ready to engage with you. using humor is is good. It usually makes the child open up, because sometimes you might have a child who might probably cause the parents to take him or her away without doing the evaluation in some extreme cases. So that is a delicate area. And so now, when we speak about case history is not a diagnostic tool. Case history, the purpose of it is to provide you with information that you yourself cannot obtain. Specific information about scores, about what sounds a child can say and what sounds a child cannot say, and so on. These are your areas. You are the expert. You are going to get a diagnostic tool, and you are going to use it, and you use your clinical observation and judgment and all of this to determine these things, and you determine that with certainty. And for the case history, we focus on the background that enables us to interpret the scores and the testing that we do. So again, sometimes you might get information from parents that is not accurate. And if someone will say, oh, my child has autism, okay, do you have a diagnosis? No, but we are sure that he does. You can't take that for its face value. You need to rely on the view of an expert. And if there's no report, then you can't just take that. And someone says, my child stutters. Your understanding of stuttering is different as a professional than someone else's understanding. So you say, yeah, okay, we are going to explore this and find out. But you don't go there and take it for granted. Now I am going to look for a stuttering assessment and I'm going to do this and that. You need to be careful about what you hear. For example, one case, I asked the parent, when did your child say the first word? And she said 6 months. That is an impossibility. 6 months is babbling stage, and the child might say dada or mama, whether the parent is in the room or not. That's a babbling syllable. So, to say the first word, it has to be intentional. Someone comes in, the person raises their head or looks at them and says dada, and so on. So again, it is very important not to take things in consideration that other people who do not know your field, conclude or come up with. You don't have to tell them, but just keep that in mind. So the goals of the case history. Case history number one. You typically send the form out. It takes quite a bit to fill it. Send it to the person, the parents, or the caregiver, and they complete it. And then you get it back, and then you go through it, and they are going to find that you are going to ask follow-up questions. You need more information about this and this and that. So you might use the telephone, you might call them by phone, or on the day of the evaluation, you spend a few minutes at the beginning and say, I have a couple of follow-up questions on this. And, you ask them these questions and you collect the information. But the goals of the case history are, number one, to identify a disorder if there is one. So the case history itself doesn't make us do that. The information you get will enable you to interpret the scores that you collect. Example, a psychologist administered an IQ test. The child got a score of 69, which it would literally put the child in the mental retardation or intellectual disability category. However, case history showed that this child was struggling in the house, didn't have much attention. Both parents are disengaged, and the child is just going to his relatives, once in a while, and the environment was very poor in terms of enrichment. The child didn't have much experience. No one read to him. bedtime stories. No one, communicated with him frequently, and all of this. Based on that background, the psychologist could not classify him as being mentally retarded or having an intellectual deficiency based on the case history. So the case history didn't make the diagnosis, but the information that was provided showed that the child didn't have the normal conditions that would enable him or would have enabled him to develop intellectual abilities that are appropriate for his age. And if you don't give someone the opportunity to learn or to develop like you give it to everyone else, then you can't call them disabled. So environmental deprivation is a big thing. Identifying the information you get also may enable you to identify the etiology of the disorder. For example, someone comes with a stuttering problem, an adult, and then you get in the case history, oh, he just got a car accident recently and he was admitted here and there. That will pinpoint, will tell you the problem, the cause. Also to understand the level of the impact of the symptoms on the person's job, work, schools, performance, and so on. And that will help you with the goals for the treatment. What do they want treatment for? And also the case history information will enable you to interpret test scores, as in the case of the psychologist, again, that I gave you, that I mentioned a minute ago. Consequently, all the case history questions must focus on the goals. Why are you getting a case history? To be able to determine if there are any possible causes in the developmental or medical or academic history that might be causing the person to have a problem in the areas that are identified as a concern. So someone, let's say, has memory problems, they have attention problems, they have difficulty comprehending paragraphs, and in their case history, they have a history of recurrent middle ear infections. Of course, that is a causal factor that points that is most likely something that I'm going to focus on, and I am going to find out, and I'm going to test and see, because of the relationship between ROM and these areas. How do we phrase case history questions? First, we need to avoid professional jargon. Every profession has its own vocabulary, technical vocabulary, and all of this. And you do not presume that everyone knows that. So you have to phrase your questions in very simple terms, in very basic terms. I say to people, phrase your questions as if you are phrasing them for a second, a first or like a child in first grade or second grade. It is not to offend anyone, but it is to make you go on the other side, take someone else's perspective, not to take things for granted. Make things as clear as possible. You must also register when you communicate with people from outside the field of the speech and language pathology and the medical field. So during a meeting, as you speak, make sure not to mention I administered the PBVT and this and that. No, I administered a vocabulary test, and this is the score. So just focus on the fact that whatever you know that has to do with your field is not going to be familiar to someone else. So make things simple and clear in your reports and in your counseling and in your case history. Parents and teachers, again, paraprofessionals, they might give you a label. They might have their own instinct as to, this person is definitely on the spectrum. I had cases where people come in and say, yeah, this person definitely has this, and they give it a name when there is nothing to support it. So, yes, listen and take note, but you can't go and base your evaluation on these things. You are the expert. You are the one who is going to answer the questions. So be independent in this area. Questions like yes, no. It's okay to ask, is your child on medications? The parent must say yes. So that's a follow-up question. Is you need to find out. Please tell me the medications. Would you tell me the medications, when they were started, how long, what the dosage is? All of this will go into your report. But questions that that you should avoid. I mean, at times when you avoid yes/no questions, are questions which should yield more information. Like you say, you want to know if there's a history of, say, brain injuries. Say, did the child ever experience a head injury? The parents say no. Then, but you just kind of, there are some other things that make you suspect. So you phrase it out. Did your child ever fall off a bicycle? Did your child fall off this or that? You know, then they might say, oh, this is what you mean by head injury. Yeah, he fell off once when this and that, or as he's playing a game, he hit his head against this or that. So again, these questions make them clear, and then you ask them about, you know, how that injury happened. Then you say, would you describe for me, you know, where and how it happened? Where was he, and this and that. Ask more open-ended questions. Please explain your concerns, you know, to me. Tell me, you know, the areas that you are concerned about. I'd like to know the strengths that, you know, this child has. And it will be, of course, better to refer to the person with, you know, to the child using their name, their specific name, because it means something to the parent, rather than saying he or she or your child. So let's look at some examples of some case history questions. Why are they not appropriate, and you know why they are? So examples: is your child's speech intelligible to unfamiliar listeners? Now, why is this question not good? Number one, intelligibility is relative. Something that you know, what is intelligibility? How much of it is, you know, should be good, how much, and so on. And also unfamiliar listeners. This is a vague term. You know, who is an unfamiliar listener? So you simply say, you know, phrase the question in a way as to make it clear. As, for example, when your child speaks with you, and you know, for example, with the family members, do you have difficulty understanding him or her? When the child speaks with strangers, do they have difficulty understanding? Instead of using familiar in terms like intelligible or unintelligible or unfamiliar, no, make it clear. Is your child's speech intelligible to? So these are two, basically intelligible to familiar listeners and unfamiliar. So again, make it, you know, more specifically stated as, do you or other family members have difficulty understanding his speech? Do strangers have difficulty understanding, or do people have to ask him to repeat, or do they have to ask him many questions while he is, for example, speaking? The questions are an indication of difficulties. So another question: which sounds in particular does your child have a hard time saying? These things you can find yourself, and the parent gets used to sounds. They sometimes do not even know that the child has a problem with sounds. They get used to the child. So again, I told you a case, shared a case where the parent comes in and I identified a problem with speech articulation, and the parent just said, no, he, is perfect. There's no problem. She actually felt offended. And it took her about 3 weeks to notice and to observe the parent. And to, coming back, she's an allied health professional, a physical therapist. And she came back and said, yeah, I actually now notice it. So a question like this shouldn't be asked in particularly. Just say, do you have any concerns about your child's the speech, like the way he or she says words? Do you have a concern about, this and that? So, but it is your job to find out what these sounds are, and you will be more accurate. I mean, what will you do with the information if the parent says, yeah, he has difficulty with this and this and that? You will find it your way anyways. So how do you phrase this question? You need to phrase it in a way, as I showed you here, how to, identify the problem in the question and phrase it in a way that will make it be more meaningful as for your purposes, for the goal of the case history. Now, here's another one. Are communication disorders as a whole prevalent in your family history? Where is family history? I mean, as a person, family history, it could be inside of the family, like here's a father, a mother, the kids, or does it include the grandparents? How far does it go? Someone who comes from, say, another country, their family history might be 5,000 people. So, and also prevalent. What does it mean? Communication disorders. What are communication disorders? You are throwing in terms that are extremely, extremely vague, and many people, people who are not professionals are not gonna know what these are. The speech pathologists, because there was some research back in 2000 showing more than 65% of physicians, primary care physicians, who did not know what a speech language pathologist did. So how can you expect a parent, to come and know? So communication, instead of that, you will say, is there anyone in your, like, say, does the father or the mother, or do you have relatives, close relatives who have language problems, who have difficulty speaking or difficulty comprehending, or spell it out? Another question, do the child's siblings have communication disorders? The same, communication disorders, what are they? The parent is not going to know what you mean. So, and if they know, they don't know what areas fall under communication disorders unless they are, somehow specialists. So, again, just you have to pinpoint it. Do they have difficulty making sounds, saying a particular sound, or do they have difficulty speaking, for example, fluently, or this or that? Spell it out. Now, before we get into the case history analysis, we need to look at some considerations, and we need to keep in mind that we try to focus on the possible causes of a disorder. As we approach that, so the information we get from parents and from other professionals, we use it to enable us to include or exclude a disorder that we are suspecting. So, for example, we as SLPs, we know that comprehension problems can be caused by many sources or by many factors. So we need to phrase the case history question based on the possible causes of these problems. So where do you get this information? It is from your ComD, undergrad ComD courses, the science courses that you had, that you understand. For example, your training should have showed you that people with middle ear infections are going to have this whole list of problems. People with head injury will have this list of problems, and so on. And so we look at the possible causes we have a list of concerns, like say comprehension is a problem, following directions, and say immediate word recall. All of these are concerns, and then we want to look in the history information that we collect. Is there anything to confirm that middle ear infections is a causal factor? Is there anything that will confirm that this and that is a causal factor based on what you know as possible causes for comprehension or attention problems or memory problems and so on? So you make that, you want to find out as many answer as many questions as possible about why the problem is occurring, what are the sources, what are the possible causes of this problem. Let's look at the case history analysis. We have 3 cases, but general tips. Number 1, when you look at the case, you need to identify key words in the question. You have to keep in mind that you are a detective. Whether you are a physician making a diagnosis, a speech language pathologist making a diagnosis, you are looking for a solution, a puzzle that you are going to construct and to use to answer questions. So you have to also keep so you look for cues in the case that you have. You are going to go back as you continue explaining and looking at. You have to go back to the case and read it again. You look at the cues again. You read the questions about the case with a critical eye. So only, again, look for conclusions that are supported by evidence from the case and from the questions. So let's see. Here's a case that you had. A high school male student who has been receiving special education support for a number of years is referred to you for an assessment. The mother says that the person stutters a lot. She reports that both she and his father have difficulty understanding him. She reports that he gets frustrated when people tell him that they do not understand him and that he should slow down. For this case, what specific areas will you target for assessment? And B, what questions come to mind at this point in the process? C, what specific information in his extensive special education folder will you look for in order to answer the questions you have? So, clues in the case. The case is filled with cues. High school male receiving special education services for a number of years. What does that tell you? It tells you that there's an extensive folder and that the person had extensive evaluations before in the reports and reports. And they have case history and they have scores and wealth of information. 2, why is a 19-year-old why is a high school person now referred to you now for a concern about fluency? Why now? We know fluency does not start, is developmental. Fluency starts as soon as the person begins to speak in phrases and sentences, age 2 years or even 18 months. Why is a concern about it now? And immediately you need to think, is there a history of traumatic brain injury, a stroke, whatever it is? But developmental will be absolutely at that stage. If that's an initial evaluation, it is impossible for someone to out of nowhere just develop a stuttering disorder. The parent says he stutters. The parents are not going to understand what stuttering is, what it is like. They are going to kind of look at everything in a whole different way. So what they call stuttering might not be stuttering at all. It might be pauses, it might be kind of things that slow down speech or different things, but might not be the classical kind. So you shouldn't immediately just go, oh, that the person has a stuttering disorder, just simply because the parent said so. The young man gets frustrated when people do not understand him. Do people with who stutter get frustrated. Yeah, I'm sure they do. They have anxieties and all of this. But the implications of the questions here is that the person seems to be oblivious in that case, doesn't know why do people get frustrated at me as I'm trying to speak. Why can't they understand me? He's not aware. So that implies you ask yourself, is the person aware of the problem? If the person is unaware, that is not stuttering. So if they are not aware, that is a cluttering disorder. He gets frustrated. So again, this implies lack of awareness. And we know people who clutter have many cognitive problems, neurocognitive problems that are causing the cluttering. And as a result, and one of these is being unaware. They are not aware at all. I had a case and I worked with the person for about approximately 1 month, completely 1 month working, and twice a week. And it was not making sense to him that he had a problem. And I continued working and tape recording him and analyzing. And finally, 4 weeks later, he says, oh my God, now I understand. He couldn't understand his own words as he was listening to the recording. He says, now I know how people feel and how they cannot understand me, how I can't understand even my own speech. So that was then awareness that I spent a lot of time working with him to build it. And this is where treatment became more meaningful. So another cue is the mother implies that when he slows down, it is easier to understand him because she said we tell him to slow down or he should slow down. People who stutter, their problem is not slowing down. People who stutter, you can understand them. Intelligibility is not typically a problem. It is the time, it is the struggles that they have. So people who stutter are aware, perhaps over-aware of the problem they have, and their intelligibility is fine. Their problem doesn't have an impact on academic performance. Typically, it doesn't. So these are questions that come to mind. Questions are, is this a cluttering disorder or is it a stuttering? And you can simply answer the question now here at this time that the cues do not support a stuttering disorder, that the person is at a high school. Why have a stuttering disorder now? That is not possible. That the person is frustrated when people do not understand him, is not aware, and that the parents imply that if he slows down, his speech will be better, intelligibility will be better, and that also means all of these cues mean that this is not a stuttering problem, it's a cluttering. Now with that question, the focus should be on finding tools to evaluate for cluttering. So the information we look for in the case history and the client's folder, we look for psychological evaluations, neuropsychological evaluations. We look for information to describe for us how his attention is, how his inhibition. People who clutter have extreme difficulties with inhibition. Verbal inhibition, they just speak and speak and speak and speak, and they're very fast and they can't slow themselves down. Also with behavioral inhibition, they usually are very disorganized outside and inside. So there's a whole list of problems that surround cluttering, and actually cluttering is a result of these neurocognitive and neurobehavioral difficulties that they have, and these ultimately must show in their history in one way or another. You are going in the evaluation reports that you are going to find difficulties in these areas. So this is what we would look for. The second case, that is an 11-year-old child is referred to you for an initial. So the word initial is very, very important. An initial assessment due to concerns about fluency. Again, it is impossible for stuttering developmental stuttering to begin after age 8. Even age 8, it doesn't. But so typically it begins when the person begins communicating in phrases, 18 months. And then we know that 75% of the cases stop within a few months, 6 months, or even a year. And then only 20% continue throughout life. And these are the ones that are true stutterers. So that is there, right? The first cue. So the parents are extremely concerned that the stuttering may jeopardize their son's promising future as a football player. So, I mean, 2 cues in that sentence. Why are they concerned now? You know, that's a sudden concern. I mean, the child is 11 years old. Why now be concerned about stuttering and that it will affect their child's performance? And then you have another cue that he plays football. Do people have injuries in football? So right up front, this case is not a developmental stuttering case. The parents also report that the boy's school performance has plummeted over the past 10 years. When you say plummet, you think about an airplane that lost control and it's going into a tailspin or going into a nosedive. Very, very quickly. We say plummet, it is very quick decrease in performance over the past 10 days. So all of a sudden, a problem started 10 days ago, and evidence of very, very significant change is happening in the person's school's performance. So upon observing the child's speech, you notice that he does exhibit significant stuttering behavior. That is your judgment. Yes, significant stuttering behavior. What are 4 most important questions that you should ask the parents while taking the case history now? So, if you are not reading the cues, you are just going to go into information that you have memorized and just go, oh, I'm going to do this, pull this from my textbook or that. No, reading the cues is going to make you focus in a whole different track. You are going now to look, this is not a developmental stuttering case. This is a brain injury case. This is a TBI, traumatic brain injury case. And the planning and the questions you ask are going to be very different. So there's no point now in asking, do you have someone who stutters in your family? When did you first, for example, do this and that? So now you need the most, and this is why I say the most important questions that you are going to find out, you want to answer are. So again, these are the cues. Initial assessment means that is not a developmental case, so forget about a whole list of things that you are going to ask. And you need to look at things that will enable you to identify the cause. So again, the parents are extremely concerned. That is sudden. That means that stuttering is a new behavior. It is not there, hasn't been there for a long time. When they are extremely concerned and so on. So that, again, most likely the problem is caused by cognitive difficulties that result from a recent head injury, or it could be a stroke. I mean, strokes can hit anyone regardless of any age. So again, all of the cues tell us that this is a traumatic brain injury case, and especially look at this. Does stuttering have an impact on academic performance? The only way it would is if you evaluate the child on verbal production, and if the child is not receiving accommodations for that. No matter what it is, if that is affecting the performance of the child, then the child will have accommodations. You know, when you grade them, you do not grade them based on how they say the words. You grade on the content and other criteria. Otherwise, that will be discrimination, and it will be a violation of the person's disability rights. So there's no effect on academic performance. Now, you can't go and say, since you say performance has plummeted, that is typically what happens when someone has a traumatic brain injury. Traumatic brain injury is very sudden. It happens in just, very quickly. And the effect of it, when you have a whole, many areas of the brain affected, that is going to cause the person to not function appropriately. So again, look at these cues, and that will make you have a whole different focus. So why are the following questions about this case? I mean, the questions to what we say to answer this. What are the most important questions that you should ask? Let's look for examples. Someone wrote, does anyone in the family stutter? Why is that not a relevant question? Again, it is not a developmental case. Read the clues. Is stuttering prevalent in your family history? If so, who else in relation to your son or who stutters? So the idea is not for you to go and read information, memorize, and come and just spill it out and on paper. Just that is not. The idea is to integrate, to pull information from different areas, to use your mind to analyze the case. When did your child begin stuttering? The question already has the answer. 10 days ago. Is this a new behavior? Again, that is just, there's no point in asking this question. Otherwise, if you do, they will really think that you do not listen to them. When did your child's performance begin to decline? 10 days ago, within the first, as they stated. Is your son concerned about the problem? What is the point of this question? Is your son concerned about the problem? Do family members have difficulty understanding him? These are late questions. There's no need to understand to find this now. These are not the most critical questions you need to ask. In what ways has your child's academic performance plummeted? How has the stuttering impacted him emotionally? So these are not the most important questions. Your most important questions must focus on the cause. You try to identify the source of the problem. You have the clues to tell you he plays sports. You have the clues to say 10 days ago there's a you should understand there's a possibility of a head injury, and you need to find out about that. So I would say, for example, do you happen to have a videotape of the game? The last game. When was the last game? You want to find out in the past 2 weeks what happened in the past 2 weeks, and based on that, you focus on trying to confirm your suspicion if there is a traumatic brain injury that was suffered during a game, or maybe there's a car accident, or maybe there's something that you need to find out the cause. So these questions that are here are not really relevant. They don't answer the question in this particular situation, in this particular case. Yes, you might ask as many questions as you want, for the case history, but in this particular situation, when the question is asking about the most important questions, for questions you need to ask. None of these questions is a question that can be included as, to really address the concern. So the test scores, again, this is your primary focus again should be on the possible cause, and test scores will not provide you with this information. This is why you go through the case history and any information that you yourself can get from your testing and observation and so on, there's no need to focus on it in the case history. It would be really a waste of time. So questions that you ask here must be focused on the possibility that there is a traumatic brain injury. And questions like this: when did your child's last game? When was your last child, your child's last game? Did you happen to videotape it? Did he fall off for example, sorry for the spelling, of something, or a tree or a bicycle, or hit his head, or get a hit to the head, and so on. The third case, this is a student who's an 8-year-old, 6 months old. She's in 3rd grade at this particular element. This is a fake name, of course. Based on the file review, developmental milestones were attained at normal ranges. Medical history is remarkable for asthma, heart murmur, and recurrent middle ear infections. Family history is remarkable for the father having ADD and the mother having a learning disability. C's teacher, Mrs. K, reported that C's performance has been inconsistent in the classroom. Inconsistent. And that she couldn't get the moral or the lesson in some folk tales or fables. Mrs. K stated that last year, C's verbal interactions in the classroom were limited, but this is no longer the case, no longer the concern at this year. Clinical observation: the speech-language pathologist says C presented as a friendly, cheerful, and cooperative young lady. No specific signs of hyperactive or impulsive behavior were noted during this testing. So at least hyperactivity, impulsivity did not exhibit itself. It didn't say there is no attention problems, because attention problems, the ADD part, didn't say anything about that. Occasionally, however, C appeared to lose focus for a few seconds, and when this occurred, she was unable to provide accurate responses, especially when repetition was not allowed. Like when you ask her to repeat a list of sentences, you can only say a sentence once, which whether she gets it or not. Where you could read a paragraph only once, and whether she gets it or not, you need to get to the questions. So there are tasks that you can't repeat. And in these situations, it was noted that she had lapses in attention. On a couple of occasions during immediate sentence recall, so she had difficulty, C was noted to distort information. For example, when I asked her to repeat this sentence, the students collected and repaired the toys and sold them at the fair. She said, the boys stole the picture at the school store. So, it was really just funny how the whole thing was distorted. So now, hearing was not formally evaluated during this evaluation. This is a statement that you frequently do if you do not screen or evaluate hearing acuity. Hearing acuity was judged informally to be adequate for conversational speech purposes. How did I know it was adequate? When the child doesn't ask you a lot of questions. Usually children who have middle ear infections or hearing problems, they say, what? And they keep looking at you, watching your lips, and trying to, find ways. So you would be able to identify hearing problems grossly overall. So when I did the otoscopic exam, one of the ear canals was clear. The right ear canal was partially occluded with what appeared to be newly formed cerumen, earwax. The tympanic membranes appeared to be intact bilaterally. So now, here's one question here now that this person has. We know she has a history of middle ear infections, and now the right ear has accumulations of earwax that is newly formed. So clues. History is remarkable for recurrent middle ear infections. This should make you get back to your COMB classes to find out in what ways does recurrent middle ear infection impact cognitive functions, language functions, and performance in the classroom. So you need to, to sort this out. And based on that, you are going to design find some testing in this area. Is it possible that these difficulties are caused by recurrent middle ear infections or recurrent otitis media? The earwax cerumen is newly formed. What does that tell you? The longer earwax stays in the ear canal, the darker it becomes and the harder it becomes. And for this reason, when someone has newly formed earwax, the question that comes up is, does she have a history of that? And if she does, most likely she will be having it cleared monthly or periodically. They would bring her, or maybe the parent has a kit that she can use to clean. So, but that means that she will be at risk for times when the cleaning is not done right, or it is not done on time, and that is going to make the ears plugged, and that is going to cause a lot of problems, attention and memory and all of this. Teachers' input: inconsistent performance during difficulty understanding moral of a story. So you ask yourself, what areas are these in? For example, the moral. What areas of language enable you to understand the moral? The moral is one thing, one line, one conclusion that you draw based on your understanding of the entire story. As the example I give frequently is the example of the story of the 3 little pigs. Once one pig builds a house with hay, very quickly assembles it, he's all set. The second one with sticks, the third one with bricks. So that is a story that is, was developed by people living a harsh life in Europe and in England and so on. And they wanted to teach their people the meaning and the value of hard work, and how, yes, it is hard and it will cost you a lot of time and all of this. However, if you do it well, it is going to stay for a long, long time. And like the moral of that is, good work is never lost. Good work lasts, and it pays off in the end. So that's the moral. So you get it based on your understanding of the entire story, even though in the whole story there is nothing that says, this statement. So this is a higher level skill that requires semantic processing and the ability to comprehend discourse. Right hemisphere functions are in the right hemisphere. The ability to understand an entire story and come up with conclusions and the theme and all of this. So now, how do you evaluate this? This is, you are going to find tools that evaluate pragmatics and find tools to evaluate, cognitive organization, the discourse component, cognitive organization, and the ability to get the whole idea. And also semantic skills. Because semantics, if you do not have a well-established semantic background, you cannot build on that. You cannot build discourse functions. What language domain includes the ability to get a moral of a source. So again, clearly it is not phonological or morphological or syntactic. These are language form. They are just, you learn them. They do not necessarily, they are not contributing to the problem here. It is semantics and discourse pragmatics. When I say discourse pragmatics, is the organization of narratives. It is the ability to summarize, big ideas into smaller sentences, utterances, and the ability to look at, cognitive sequencing and so on, make conclusions about things. So, again, we know that a lot of these functions are right hemisphere functions. I'm not concluding that she has a right hemisphere damage, but I'm saying that you need to look for a test that is going to focus a lot on semantic and pragmatics, especially discourse pragmatics. The pragmatics that is mostly tested in speech and language, mostly, like in the Castle and other, and self and so on, is more the social pragmatics. But when we say discourse pragmatics is organization of your narratives, coherence, sequencing, and all of this. And when you produce, this is what you do. And when you also comprehend, if you don't have adequate organization and coherence and all of this, you are not going to be able to follow the sequence and to integrate information in a discourse, so you can assemble or get out of that a moral or a general theme. So also you ask, if I read or listen to a story and randomly miss words and sentences in that, will I be able to get the whole picture? So my question is, vocabulary is going to show up again. There's a history of middle ear infections, and that causes the child not to acquire certain vocabulary words depending on when the ears are open or closed or plugged, when there's fluid, when there is not, and so on. So all of this will cause gaps in vocabulary development, and these gaps ultimately will have an impact on the ability to produce and to comprehend narratives and other components. Questions you should ask yourself now: can recurrent otitis media cause lapses in attention, and can it also cause inconsistent comprehension? And the answer is yes, it definitely can, and it's one of the major causes of these problems. So we need to find out how to evaluate that. We need to find information about the auditory processing abilities of this young lady. Is earwax a contributing factor? Most likely, yes, because she seems to have this problem recurring as well. And it seems that even though she gets sick, her ears cleaned, there's evidence that, new earwax is forming faster or is not caught in time. Do recurrent otitis media and cerumen buildup cause semantic deficits? These are questions, of course, yes. And as a result, what can I do to evaluate these areas? Do they cause discourse pragmatic difficulties? They do. So all of these questions are things that you ask, and you are going to integrate information from multiple sources to finally make a determination about what to evaluate. And in your interpretations of the scores also, you are going to have to rely on analysis and making very, very complex kind of conclusions. So another question here: based on the information given, how specifically will these difficulties affect her performance in the classroom? And the question says, be very specific. That is not just random there. Being very specific, pinpoint, really, really provide an answer that is going to answer the question. So all indications here appear to suggest that we are dealing with, number one, A, semantic and pragmatic difficulties, and B, inconsistent attention skills that are impacting immediate recall skills. So you have cognitive issues, you have language issues. And there's also a possibility of auditory processing issues, because simply recurrent middle ear infections is going to contribute. So all of these are known to result from recurrent middle ear infections, recurrent otitis media. The child's medical profile and information collected support the possibility that these difficulties are possibly caused by recurrent otitis media and cerumen buildup. And that is going to make you focus your evaluation in a different way, of course. Just simply coming up with this conclusion, knowing what the possible cause could be. Another question: based on the information given, how specifically will these difficulties affect her performance in the classroom? So, actually, I think this is the same question. Yes, that's a continuation of that. So we should ask the following questions again. to be able to answer them by recalling your from your undergrad education. What classroom subjects depend on semantic skills? We have said semantic skills, we have said discourse pragmatics skills. So what classroom areas now you want to connect your conclusions to functionally to the classroom? Semantic skills. So the areas that depend on semantic skills include vocabulary learning. Semantics is words and sentences. So vocabulary is the word level of semantics. So basic semantic skills. Vocabulary learning is affected by semantic skills. Reading comprehension, science, social studies, math, history, for the ability to follow directions in any class, understanding implied utterances in any class, and in any subject, again, that involves written language. So she's going to read any text in the class, you are going to count on that she's going to have difficulty following directions, difficulty with understanding abstract language. So if the scores in semantic testing, if the scores are decreased, we can say her performance in reading comprehension and this and that are caused by difficulty with semantic skills. And then it leads to treatment and say, now one areas that I need to focus treatment on is semantic skills to strengthen semantic skills. So now you see how everything connects and one thing leads to the other. What classroom subjects depend on discourse pragmatics? And so the ability to summarize information in reading classes, science, history, social studies, any area that you have information that is, written in paragraphs or even presented orally and so on the paragraph level or sentence level, that especially beyond the sentence level, that is going to be affected by discourse pragmatics. If I present to you a paragraph that has things are mixed up and, for example, I say the three little pigs, I begin speaking about the first one, did this and that, and then I go to the third one, did this and that, and then I jump back to the first one and then come to the second one. That is going to wipe out your comprehension abilities. You will not be able to get a whole understanding of the thing as a whole. So the ability to produce narratives or to comprehend narratives is very much dependent on how organized that narrative is. And it's going to affect all subject matters. So being able to get the big idea or the whole picture of a story or a lengthy text like a novel or short story, all of these are parts of discourse pragmatics. And how do you evaluate this is to basically do it through comprehension tasks and also through analyzing verbal performance in terms of coherence, cohesion, and the four aspects of the principle of cooperativeness or the cooperative principle that we discussed a while ago. So now here, provide a complete list of the steps from the very beginning to the very end that you will follow to conduct a thorough assessment of this case. Your list must include all procedures that you will follow and all assessment forms and full names of the instruments that you will use. So since we are dealing with a case here that's mostly associated with recurrent middle ear infections and cerumen buildup, and since we know that the effects of these on language skills and academic performance, that are confirmed that these things have an impact, we should target the assessment of the following areas. Number one, semantic skills and pragmatic skills. Vocabulary skills are part of semantics. Comprehension on the sentence level and on the paragraph level. because sentence skills are gonna now give you ideas about semantics, and paragraph level give you idea about pragmatics. Auditory processing skills, including immediate word recall and immediate sentence recall, and hopefully digit recall, because in many cases you get these three together, like the TAPS R or the TAPS 3, for example. Other related areas should be evaluated as well. So you get these, but in order to administer a whole battery, you are going to have to, or to get a whole language score, you might have to administer one extra test here or there. So the clues that, again, in this case, in any case, you are going to do a language sample, get a language sample. But the way that you analyze it, you have to be careful. You analyze a language sample in terms of a mean length of utterance. Below, if the child is 6 years or below. Beyond 6 years, the mean length of utterance is not meaningful. So you evaluate the sample based on different things. Informal analysis. So if you have a case which, say, a 7 or 8 or 9-year-old, and you are going to say, I'm going to do an MLU, that is not relevant. The whole question is not answered. And what will you evaluate then the sample on? You are going to use your own judgment in that analysis. There are no standard tools in that regard here. So you look for diversity of vocabulary. Is the child repeating the same words over and over in that sample? Does the child keep, say, starting an utterance and then going back and changing and putting gap fillers and things that show that there's some word retrieval problems? And then you look for the 4 elements of cooperativeness, which are how much language the person is using to answer questions, quantity, quality, and relevance and manner. These are very, very effective tools in enabling you to see how someone is using language verbally in order to express herself or himself. So that's the focus of the language sample. For people below age 6, then you get the MLU, and that tells you if the syntactic complexity that you predict, for example, is that they have syntactic complexity or not, and to give an idea, a prediction about the language development. But this is how it ends. But above that, you focus on cohesion, coherence, and other parts of discourse. In terms of justifying what to test, you for yourself, for example, you have a test. You need to answer yourself, why am I choosing this particular test? So, for example, we choose tests that evaluate areas of difficulty that we identified, for example, through case history and so on. So since we know that semantics in that case is an area of difficulty, we need to evaluate vocabulary. We need to evaluate the basic semantic skills on the sentence level and on the word level. So the word level is vocabulary. And we need to look for, in that case, I'm explaining that if someone's vocabulary is decreased, that will cause them to have fragmented comprehension. Imagine you have a paragraph and selectively take out 5 words out of that paragraph, just completely erase them, and have someone read that paragraph. Will they have difficulty understanding the paragraph? The more words that you have that you erase or take out of that paragraph, the more difficulties they have. And in some cases, a single word in a paragraph can be the whole focus of the entire paragraph. So, having vocabulary, difficult words or words that are not familiar to the person, and that is going to cause very fragmented attention, comprehension, and the person is not going to be able to integrate things when they read the paragraph at the end. They can't get the whole idea or the moral or whatever general ideas. Decreased vocabulary could also impact working memory, and it could also impact immediate recall, as I explained earlier. Lastly, recurrent middle ear infections or recurrent otitis media is known to cause vocabulary gaps and decreased vocabulary overall. That means vocabulary is inconsistent. You might say if the child had frequent middle ear infections between ages 3 and 4, the vocabulary in that period of time is going to be all affected. And then the person is now, the problem went away and they are learning. They would know age level vocabulary today. They are fine. But nothing is going to fill in the gaps that they lost in the past. So you're going to find gaps that must be filled. So inconsistent vocabulary is going to contribute. So you must evaluate vocabulary in that case. Why test auditory processing skills? Because again, the whole case is about auditory processing. Recurrent otitis media is hearing. Auditory processing, again, is very subtle, and by the time you come and evaluate it, in many cases the person doesn't have middle ear infections, and all of the past history that actually caused the problem, is no longer there, but the problem stays. So we need to test areas of immediate word recall, immediate sentence recall, mental concentration, and cognitive manipulation. You get these by immediate word recall, again, forward, digit recall, forward, like 1, 2, 3, 4. And you get word recall, sentence recall, and short story recall is also part of the TAPS test. It seems it's one of the best now to evaluate because it's no longer included in the working memory stuff. So auditory discrimination skills are also part of the TAPS. That will also give you clues about this and answer questions that you have, and also other areas that are typically part of the battery for the auditory processing test. This will be very, very important, and that will justify now why you are gonna give this particular test. Testing for auditory comprehension. This is again a critical area. In addition to the fact that the person, it's an area of concern, it is also an area affected by recurrent middle ear infections and auditory processing skills. You should test sentence comprehension. You should test comprehension on the paragraph level. And you can do this by either the SELF or the CASTLE or some other test that evaluates this area. And when we examine the scores now, we need to ask, because you need to look at all the scores and analyze, come up with conclusions and so on. So you ask, for example, is performance worse on paragraph level than on sentence level for say comprehending meaning on the sentence level versus the paragraph level? If so, it will clearly show that the longer the text or the information is, the harder it will be for the person to process. So now you have an effect of memory and attention contributing to the problem, because the longer you have, memory cannot stand that, and the attention cannot be sustained. So this is where you go back to the case history and say, well, the profile shows, the history of middle ear infection, the history of inattention here is having an impact. It is not just completely a linguistic or an auditory processing thing. It's multiple factors. So now, to what extent does vocabulary contribute to these issues? To what extent does short-term memory contribute? So when you look at your scores that you get, if the vocabulary, for example, is miraculously average, then you say, vocabulary is excluded, and the problem will be more attributed now to memory and attention problems. To what extent does short-term memory or immediate recall contribute to these difficulties. In your analysis, again, you look and see how consistent these scores are, and based on the scores that you get, you can determine if they are contributing, if memory is contributing, and if so, to what extent and under what conditions. Like, does memory decrease during word recall or sentence recall, and so on. To what extent do mental concentration and mental manipulation skills contribute to these difficulties? Again, based on the scores that you get, if they are decreased, you say, it is clear that this person's decreased scores explain why she is having difficulty, with comprehending paragraphs. So if you find multiple areas showing decreased scores, then you say the problem is most likely caused by decreased vocabulary, decreased memory and attention, decreased mental concentration. And then your treatment is going to be based on focusing on these areas to improve their function, the person's function. So again, the nature of the diagnostic process is like you are a detective. You might have millions and millions of files in your office and a lot of information, but in the end, you as the detective, you as the one who is going to make this information meaningful by going out and searching for more information, coming back and putting one piece from a file with one piece that of a case history form that someone gave you, and it is that ability to enable you to analyze in the end that will make you an excellent diagnostician. So do not rush. As you study the disorders, individual disorders, this ability, this skill you are going to develop it gradually. But I hope that your awareness of it now and how this whole thing works will make you realize that these are questions where you cannot find the answer in just one location. You have to pull the answer from multiple areas. And the difficulty is not in say, how a textbook is constructed, or how a person teaches a class, and so on. This is a huge area, and you build up the skills gradually, case by case, disorder area by disorder area. And in the end, I am confident that you will get there. So thank you and best of luck.